Hi and welcome. I'm trying to learn medicine. Today, the Achalasia of the cardia. And after we've done it, we're going to do squat training. And if you participate in the squat training, then it's very harmless. And this is part 3 of the Achalasia of the cardia. And this is no medical advice. We're just trying to learn about it. And we're talking about internal anatomy and a disease or an illness. Okay, we are pretty close to be able to say shortly what Achalasia of the cardia is. I don't know what the cardia is and what Achalasia is, but okay, Achalasia of the cardia. Now, where is the oesophagus? And from the oesophagus, the food comes from the mouth into the stomach, and at the end of the oesophagus, there is the sphincter muscle ring at the end of the oesophagus. The oesophagus is a pipe, and at the end is muscle. Now, now the problem with Achalasia of the cardia is that the swallowing does not properly. Is it not a problem that the swallowing is not started? I think it's that the muscle ring is. Let me explain how it is normally. And by Achalasia of the cardia, the response to the swallowing of the esophagus to push the food in the peristalsis and the wave-like movement downwards called peristalsis, and the relaxation of the muscle ring, the sphincter at the end of the esophagus, doesn't work properly, and the food gets retained through the salvia in the esophagus. That gives a feeling of pain in the breast and also problems of swallowing food and drink. And the food fails to be sticking, and regurgitation of undigested food and drinks is also possible, of food and saliva. Regurgitation, okay, but what do we have? Pain, we have the breastbone, so problems of swallowing of drinks and food, and a feeling of food getting stuck. Chest pain, and food felt stuck behind the breastbone. And now it can also happen that it is a feeling of food getting stuck behind the breastbone, chest pain, and difficulty in swallowing, and also regurgitation of food and saliva. And also the food and saliva is retained in the esophagus can be breathed in into the lungs and cause cooing, breathlessness, and chest infections. And complications of all that is pneumonia and bronchiectasis. And also is then high increased risk of esophageal cancer. And I could say that, right? The cause is unknown, so no prevention is possible. There's a general advice to eat smaller meals, seated, and there are surgical possibilities like making a cut or a stretch into the sphincter at the end of the esophagus, so relax the situation, what do we say, to allow food to pass in the stomach. I have a second camera which I'm going to start now. And let's try to say what we have time for 2-3 takes. Achalasia of the cardia. The food comes normally from the mouth of the esophagus through the muscles ring, the sphincter at the end of the esophagus down into the stomach. But by Achalasia of the cardia, that doesn't happen properly. Normally, the swallowing makes the proper peristalsis movement, which pushes the food down in wave-like movement and through the muscle ring, the sphincter down into the stomach, but it doesn't happen properly, and the food and the saliva gets retained in the esophagus. And that causes a feeling of pain and also a feeling of food getting stuck behind the breastbone and also regurgitation of food and saliva. And it can happen that the retained food and saliva gets be inhaled into the lungs and cause then pneumonia, chest infections. And all over these complications are pneumonia, bronchiectasis, and an increased risk of esophageal cancer. The cause is unknown, and so also no treatment, no prevention. As treatment, there are advice to make smaller meals, seated up, eaten, and there are also surgical options like making a cut or a stretch into the sphincter at the end of the esophagus to let the food better pass. And that is according to Keith Hodgkin's Family Medical Advisor, page 60 but this is no medical advice. Now I'm going to stop the camera. I forgot to mention two things. I don't think they're so important. Right now we're going to do one time maybe an overall there's a word of fame more information to all of it. But for now this is good. We have what Achalasia of cardiac is quite good. So this was the medical part. If you are here for medicine, you can go directly to the next part of medicine. We will do now the squat training. If you stay and participate in the squat training, then it's better to be honest. We are bringing one leg up and we're doing the greeting mushroom. Foot up and down, up and down, up and down. Let's continue with the greeting mushroom. Circle the foot and also in the other direction. And the other leg up and do the greeting mushroom. Bring the foot up and down. And the greeting mushroom, circle the foot and the other direction. And now let's do the train stop look over to one side. The foot are pointing forward, the foot are pointing forward, and we're stretching the inner side of the leg. And we're going to the other side. The toes are pointing forward and we're stretching the inner side of the leg. And we're doing the mantis go from side to side. Now to the squats. We're just doing 10 squats, legs wide apart, and we're going down into foot squat. That was the first one, and the second one we're doing 12. So it was the third one, and now the fourth one, and the fifth one, and the number 6, and now we're having the half, and the 7, 8, 9, and last 4, 10, 9, so that's 3. And now to the next exercise. It is my 6-pack squat squeeze. Leg wide apart. We're going down to quarter squat. Press against the top of the leg. Only with one arm. Now the other side. Now go down into half squat and press on the middle of the upper leg. On the other side. And down into 3/4 squat and press close to the knee. Other side. And we come up again. And now the fastest giraffe of a water pond. We're going down into 3/4 squat and we're pressing against the knee. And we're going towards the knee. And on the other side. And again. And again. And the last 2. And the last exercise, the propeller. Legs wide apart, down into foot squat, arms to the side, over to one side, press against the leg and look up to the hand. Little bend in the elbow. To the middle, out to the other side, press against the leg, look up to the hand, little bend in the elbow. Into the middle. That's also squat training. Now to the stretching. So first the walker. And then let's do the garden gnome. Pull the toes in. And move the leg from left to right. Aber heel to unusual ground. Pull the toes in. Move the leg from left to right. And the train. Take the leg at the ankle. Make a straight back and point with the knee down to the floor. Other leg, take it at the ankle, straight back, point the knee down to the floor. And what was it? No, let's end with a trunk igniter. Breathe in. Out. Another round, breathe in. Out. Now last one. Out. Breathe in, close the legs. And out. That was my squat training. I thank you very much and until next time.